I was working at the VA, and we had somebody who came in complaining that something felt off with their vision, that their vision wasn't clear. Now, when we quickly checked their vision, they were still reading 20/20 on the vision chart. But what we looked inside, we actually saw a significant amount of not only swelling of their optic nerve, but also some hemorrhaging in their retina. So when we see this, it's obviously concerning. We actually did a couple of imaging techniques, something called an OCT, an optical coherence tomographer. This is kind of like getting an MRI of the back of the eyeball. With this individual, we were able to visualize and even image this massive amount of swelling of the optic nerve. And so it was a good lesson for me as a student to just recognize again that even though vision was good, there's this neurological thing happening more so deeper behind the eye that we need to be addressing and be concerned about. Hey, sunshine there, my friends, and welcome to the Dr. Eye Health podcast. I'm your host, Dr. Joseph Allen, and on this podcast, we help you not only protect, but preserve and also optimize your vision and eye health, but also your overall well-being. Now, this is pretty early on in our podcasting journey. I've been producing eye health education around eyes, vision products over on YouTube and across social media for about 8 years now. But here I wanted to start kind of a new conversation in podcasting form so that whether people are on their commute to work, or if you're maybe doing chores around the house, or if you're on your afternoon run exercise and you want to listen in and you want to learn about eyes, vision, and also just how the whole body is connected and what we can be doing to better ourselves and our overall well-being. That's really what I wanted to start this podcast for. Now, in today's episode, I wanted to sort of set the table. I want to kind of give us a look at how the eyes are connected to the rest of the body and why eye health matters more than people think. Because again, a lot of people come in to see an eye care provider like myself or other colleagues because they can tell something's wrong, right? They can tell that their vision's a little fuzzy, they're having a hard time focusing, they're having eye strain, or perhaps they're having spots in their vision. Hopefully it's not where suddenly they have vision loss, although that does happen. Or perhaps they have a family member, like maybe a parent. Their child will be struggling in school, or a teacher will mention to the parent that, hey, I see that your kid is squinting a lot, trying to see the board, or there's something going on like that. And that's what brings them in to see us in the eye clinic. Unfortunately, I think there's a disconnect, and people don't realize what an eye exam really entails and all of the things that we find and can detect about somebody's health just from looking inside their eyes. In fact, I actually had a patient that came in to see me because he worked for one of the major health insurance companies here in the US. And he came in, he had really no vision issues. He came in simply because he had run the numbers. He had run the numbers of how an eye exam was the most affordable, most efficient, and least invasive sort of examination or procedure that could result in showing the most kind of health things about his internal health, about not only kind of what's going on systemically with blood flow, with risk for things like high blood pressure, diabetes, cholesterol issues, but also for neural health, things like how your brain is operating, functioning, and risk for future things like dementia, all for example. So I did want to kind of, again, set this playing field, kind of explain what's going on, give some insights to what we're doing, but also kind of give a call to action of why it's so important to have an eye exam. Just want to share a story because I also had a patient. This is actually a story I think many eye doctors share, and I have it frequently, but I do remember early in my career, I was out of residency and I was seeing a patient, and he was in his mid-40s. He had come in simply because he had never had vision issues. His vision was fantastic. In the distance, he never needed glasses or anything. And so he hadn't seen an eye doctor since he was in high school. And he's in his mid-40s now, and he's starting to struggle with a thing that many people in their middle age, mid-40s start to struggle with, and that is vision seeing up close. And this is a normal thing as we get older called presbyopia. It's where the lens inside the eye, which is normally very flexible when we're young, starts to crystallize and becomes more rigid. And so even though the muscles inside your eye are pulling on it to try to focus on something up close like your phone or maybe a menu at a restaurant, the lens does not want to change shape, and so it becomes very sluggish. It was taking him longer for him to focus up close, and then it was taking him longer to relax that muscle to see in the distance, and he didn't want to have to just start using reading glasses without knowing what was going on or what power to use. And so he came in to have his eye exam. Now, being that he'd never had an eye exam before, and even though we had taken photos of the back of the eye, I encouraged him, no, we really should dilate the eyes. Let's do a full comprehensive look. Let's take a look at what's going on. So we did. We put eye drops in his eye that relax his pupillary muscles, and that gives us a better view inside the eye. And when I was looking inside the eye, and I thought, oh, this is all just going to be a very routine exam, but look inside, and no, he has small hemorrhages. He was bleeding inside of the eye. And when the eye bleeds, it can bleed in different patterns. And the specific type of hemorrhaging he was having was very characteristic of diabetes. And it was in both eyes. And even though his vision was excellent, right, he still was able to see 20/20 without glasses at distance. You know, he still needed something like reading glasses to see up close, but he didn't even know that he was bleeding inside the eye, right? It wasn't affecting his vision at that point. But because of what we saw, I, of course, wrote a letter. I talked with the patient about it, that I was concerned that he might have something else going on, like maybe diabetes. We checked his blood pressure there in the office. Thankfully, he was fine. But we referred him to his family doctor, his primary care provider, so that they could do additional blood work and eval if perhaps he did have diabetes. And sure enough, he was referred back to our clinic in some time later to do additional testing for things like diabetes and risks for other eye conditions, because his family doctor confirmed, yes, he was diabetic. And this was a huge moment because he didn't know he was diabetic, but he hadn't seen a family doctor in about a decade or more. So at some point, he had started probably to develop diabetes. It had never been checked. He felt like he was seeing fine. It was something that kind of snuck up on him. And who knows, if he hadn't come in to see us, we wouldn't have been able to catch this. He may have gone another 5 or even 10 years before catching anything else. And again, thankfully, it wasn't affecting his vision significantly at that time, but if it had gone unchecked, unregulated, untreated, he likely would have gone down a path that could have resulted in more significant and even potentially permanent vision loss. And again, this is just a reflection of, again, how our whole body is connected. So inside of the eye, in the very back of the eye, we have an intense amount of blood vessels. The eye actually has what's called a dual blood supply. So it actually has blood flowing inside of the eye to nourish not only the tissues of the eyeball, but the inner retina, but also it has a blood supply on the back through something called the choroid, which is a very fine, tight meshwork of small little blood vessels. And so this is essential because of the back of the eye, the retinal tissue is an extension of the brain. It is neural tissue. It is part of your central nervous system that extends forward. And one of my other colleagues here in the eye care profession once brilliantly said, the eyeball is the only internal organ that is exposed on the outside of your body. And that's kind of how I think about it, because when we look inside the eye and we see all these blood vessels, again, they could be being damaged over time. They could be damaged by an infection or something else going on. And so it's not uncommon for us to diagnose conditions like diabetes or conditions like hypertensive retinopathy from people who have elevated blood pressure, right? Elevated blood pressure or hypertension is known as the silent killer. It often sneaks up on us without ever knowing that something is actually going on. And it's actually something I think is rather underdiagnosed in the field of eye care, because when people come in and we look inside the eye, we can see subtle changes to these blood vessels and the lining of these blood vessels that ultimately can increase the risk of not only hemorrhaging, but essentially strokes within the eye. But the eye is, again, a reflection telling us of what's going on inside the body. So if we're seeing this damage from high blood pressure or diabetes, then we know that this is also occurring in other parts of the body, such as the kidneys, potentially in the liver, and then even in the brain. And that is one of the reasons why we kind of are concerned about long-term damage from things like cardiovascular disease, diabetes, high blood pressure, and even elevated levels of cholesterol. In fact, high levels of cholesterol show up in the eye too. It's not uncommon that once you're over the age of 45, and even more common as the older you get, we can see elevated levels of cholesterol depositing on the surface of the eye, something we call arcus senilis. But then we also, on occasion, can catch what are little plaques, right? If you've heard of people having plaque in their arteries, in their heart, in their carotid arteries, these plaques can release and get stuck in the very small blood vessels in the back of the eye. And we can see that somebody has had essentially a small stroke that not only may affect the eye, but if we catch that, when we know that they're at high risk of something similar happening and ending up in the neural tissue in the brain, and that could result in a full-blown stroke. Or they also have risk of heart attack. So these are big issues that I'm constantly just thinking about, reflecting on, things that we see every single week looking in the eyes of our patients. In addition to this, one of the big things, again, we're looking through the eye, we can see the optic nerve in the back of the eye. And again, the optic nerve is where all of the neural tissue, all of the signals, these retinal ganglion cells, that receive light information to the photoreceptors in the eye, they have to send that information. It's like sending information through a hard cable or a wire to a computer, but this wire connects through the optic, is essentially the optic nerve, and sends this information through the brain so that your visual processing centers actually get that information and they help you see. So when we look at the optic nerve, the nerve can be damaged from many different things. And essentially, evaluating the health of the nerve, in fact, tells us quite a bit about what is going on neurologically, whether it's because of somebody's had inflammatory issues related to multiple sclerosis, or maybe they've had an infection, or perhaps they have issues with their cerebral spinal fluid and their optic nerve is now looking swollen, whether it be because they have, again, some infection, or if perhaps they have had an injury or a malformation of some kind, or perhaps they've even just taken too many supplements, like vitamin A toxicity can in fact lead to swelling of the optic nerve. There have been case reports on that too. In fact, this reminds me of a case where I had a patient who, this was actually at the end of my last rotation as a student in optometry school. I was working at the VA and we had somebody who came in complaining that something felt off with their vision, that their vision wasn't clear. Now, when we quickly checked their vision, they were still reading 20/20 on the vision chart. And so we didn't really think, maybe it's not that serious, maybe it's a small amount of astigmatism, but it can't be that serious. But as a student, whenever there's overflow or something like that of somebody who's kind of like a walk-in patient, it all gets put on my schedule. So this patient, again, we sort of didn't think it'd be that serious because their vision was largely still good when we just quickly checked it. But what we looked inside, we actually saw a significant amount of not only swelling of their optic nerve, but also some hemorrhaging in their retina. So when we see this, it's obviously concerning. We actually did a couple of imaging techniques, something called an OCT, an optical coherence tomographer. This is kind of like getting an MRI of the back of the eyeball, and it can tell us if there is swelling of tissue in the back of the eye of the retina, if there's like maybe blood pooling in a certain area. It can also tell us if there's thinning, if maybe cells of the optic nerve have been degenerating and have been lost, whether that be because they had some event where they had lost blood flow to that part of the nerve, or perhaps it got pinched off due to elevated issues with eye pressure, like such as with glaucoma. But with this individual, we were able to visualize and even image this massive amount of swelling of the optic nerve. And in this case, it was due to basically the cerebral spinal fluid of this patient had been being choked off. And because of that, the increased level of cerebral spinal fluid pressure around the optic nerves was essentially kind of choking the nerve in a way. And so something called retrograde axoplasmic flow. So the nerve has to send like healthy metabolites through a way to keep the nerve healthy. But because the nerve was being pinched so hard, it couldn't send its own metabolites back to the rest of the nerve to basically regenerate and keep itself healthy. And so the nerve was trapping all those metabolites in the front end at the optic nerve head. So I could see this massive amount of swelling. And so it was a good lesson for me as a student to just recognize again that even though vision was good, there's this neurological thing happening more so deeper behind the eye that we need to be addressing and be concerned about. Now, for that individual, even though she felt like she could tell as a patient that something was off in her vision, even though visual acuity was 20/20, we did do a side vision test, something called an automated perimetry test, where we flash little flickering lights to their side vision. And then when they see the light, they click a button, and then it changes the brightness and location of those lights and changes them all the time to verify, hey, what level can you detect this? At what level can you not? And certainly we saw a large diminished in her perimetry. Her side vision was being affected. And so this just again goes to see that even though she could see 20/20, that is not all that vision is, right? Just because you can see fine letters on a vision chart doesn't mean your vision is healthy and that it's normal. And so I also give this as a call to action to you. If you feel like at some point your vision just feels off, even though you feel like, hey, I can still read this, there could be something else going on the sides of your vision. There could be something else in the ability for you to detect contrast or color vision that is being affected by something else health-wise internal that could be happening. And so this was, again, just a huge lesson for me, and I think a good just reflection of how involved the eyes are in terms of its relationship to our brain and, again, our overall well-being. Again, the eyes are the only part of the body and the only part of the brain that a doctor can see without opening up your skull. In fact, your vision is brain function, right? How you see and how you use your eyes is a direct reflection of the health of your brain and how you're mentally thinking about things. Because your brain is constantly processing, predicting, and reacting to what it sees in your visual environment. They say that about 70% of your all of your kind of sensory input is visual. It's because of things that you're seeing in your environment, and it's sending that signal to your brain, and you have to kind of decode it, break it down, and make sense of it. And how you use your eyes, looking from left to right, I mean, this is something you've probably done since you were a young kid. You've tracked a ball moving across like a field, or you've seen a car moving from left to right or right to left, or something like that. You're constantly kind of evaluating and predicting where it's going to be going, at what speed. This is something that a lot of professional athletes have become incredibly advanced at. They can see a ball for just a half a second of what trajectory it is and predict where it's going to be going so that they could even close their eyes, reach their hand out, and like catch a baseball, for example. And so this is, again, just a reflection of how healthy eye movements also kind of reflect of what's going on with visual processing. Disorders like concussion, anything like multiple sclerosis, Alzheimer's even, they all can start to lead to breakdowns in how you use your eyes and your eye muscles. So eye tracking is something that's becoming more and more utilized in healthcare fields, especially in advanced areas like looking at how can we diagnose, track the progression, or even track treatments of things like with Alzheimer's and other forms of dementia, along with Parkinson's. But if somebody has ever had like a head injury, like myself, I'll admit I had a concussion back in March of 2025. I was snowboarding and we don't know exactly what happened, but I must have fallen and I hit my head pretty hard. Now, thankfully, I recovered really well. I did have some short-term kind of memory loss issues, but it all came back. During the time, I was constantly checking my eye muscles and my focus ability, because this is something that eye doctors know very well, that when somebody has head trauma, a traumatic brain injury, a concussion, this can significantly affect your coordination of your eye muscles, both the internal muscles called the ciliary body, which affect your accommodation, your ability to change the shape of the lens and focus on a near object, but also your ability to move the external or extraocular eye muscles, to move the eyes to focus together to keep things single. Otherwise, because you have two eyes, if they work disjointedly, you could end up seeing double, or perhaps they end up struggling to maintain fixation. So imagine being able to look at your phone, get it clear for a moment, but it only stays clear for just that 1 or 2 seconds, and then you start to see it split into two and going double. So it's actually quite common to detect these sort of things, and it becomes really important for eye care professionals, if somebody has ever had a head injury or a family member has a head injury, to make sure that they can be evaluated by an eye care professional so that they can do just even rudimentary tests to see if there is something going on or a deficiency or a misalignment in some way going on with the eyes and the focusing ability, and if something else needs to be maybe rehabilitated. Thankfully, there is a lot of interest and focus in areas of vision therapy or ways that they can rehab how the eyes work together as a team. It's not as much of strengthening the true muscles of the eye. It's more about improving the communication and connection neurologically from the brain to those muscles of the eye so that they can work in synchronous in the way they're supposed to be. But again, this is a very fascinating area of how complicated our neurological system is and how it and our eyes are strongly connected to it all. But eye health is not just about disease. It's about focus. It's about performance. It's about your quality of life. Again, we use our eyes for so many different things, and a lot of people I know, whether you're listening or maybe you're watching a video, your eyes, you've probably at some point felt some level of eye fatigue, or especially now staring at screens, what we call digital eye strain, formerly known as computer vision syndrome. And this is that feeling of your eyes feeling tight or fatigued, tired, maybe even somewhat feeling dry, feeling like they burn, because a lot of eye strain is in fact related to dry eye issues. Because when we stare at a computer screen, we don't blink as often, and we often don't blink as completely. It's kind of like we're in a more sympathetic, like we're trying to hyper-focus and kind of attack something. And so in those sort of survival moments, we don't want to blink as fully. We want to keep our eyes open to receive as much visual information as possible. And so that leads to an issue where your tear film is more exposed to the environment, to the air, and the tear film evaporates faster. It's not having a nice smooth coverage of your tear film. And so that results in a lot of issues with dry eye and eventually leading to not only dry eye symptoms, but dry eye disease for a lot of people. But this kind of relevancy of how our visual performance affects our quality of life is extended beyond just work. It goes into certainly our daily activities of just day-to-day, kind of waking up in the morning to the end of the day, to certainly our sports performance. If you're a student, your kind of visual performance in school. And this is a reflection also of your fatigue, of how much sleep are you getting every night? How well are you taking care of yourself in terms of your nutrition? Right? The back of the eye is, again, one of the most highly metabolic tissues in the entire body. And if you're not getting good nutrition, if you're not staying well hydrated, how well are these metabolites getting to the back of the eye to reduce oxidative stress, to help reduce inflammation? This can not only lead to disease, but perhaps even dysfunctional visual quality. So there is some fascinating research. If you've been following my kind of story at all, I've always been really fascinated with nutrition and taking supplementation and trying to understand where research is at. Because in the field of eye care, it's one of the only parts, a field of, say, in medicine, where it is standard of care for us to prescribe a dietary supplement, specifically in the condition of intermediate stage macular degeneration. There's some huge landmark studies that were able to show that a certain cocktail of certain micronutrients and vitamins were able to slow down the progression of that disease by taking a supplement. And so that has always been kind of a fascination of mine of, okay, if we can take this supplement and slow down the progression of disease, is there anything else we can do, whether it be supplementation or just diet alone, that can only help reduce our development of disease, but also enhance our visual function. We are going to be bringing on some guest lectures, some interviews with some of the leading researchers in the area around nutrition in the eyes and visual performance. And that's something I'm really excited to kind of share more so on, because I know for myself, even digging more into this research, it is just fascinating to hear how simple things in our diet, or if somebody doesn't want to eat those foods, like if you're somebody who doesn't like eating green leafy vegetables or you have a hard time digesting it in your stomach, there are supplements that people can take that have been shown in research to boost pigment in the back of the eye, and that can result in improved contrast acuity. It can improve in someone's visual processing, in their memory, and even having other benefits throughout the body. Now, of course, there's so many eye diseases that we're going to be covering in future episodes. We're going to be talking about macular degeneration. We're going to be talking about glaucoma. We're going to be talking about all of these different conditions that certainly are visual and affect the eyes, because as an eye doctor, that's kind of a major area. But we're going to be talking and bringing on specialists that cover all these other major topics, things like endocrinology, and certainly how our risk for diabetes affects the whole body. We're going to be talking about thyroid conditions. We're going to be talking about how sleep affects not only our eyes, but our brain and our overall well-being, and sharing, of course, actionable tips and steps of things that we can help improve our overall, our whole bodies, but our overall livelihood for not only us, but our entire family and everything going forward. But I personally try to think, if you're a car owner, it's best to not wait to see the check engine light come on in the car. No, it's best practice to be regularly checking the oil in your car, to be checking the fluids, to be checking the air pressure, to make sure that you're bringing in for regular maintenance. And that's just a reflection of how much we value our bodies. We should be don't let that check engine light come on, right? Especially when it pertains to your vision. Don't just wait for your vision to go blurry to come on in to get your eyes checked. We want to take care of everything. That includes sleeping well, eating well, exercising on a regular basis, focusing on just taking even that moment to do a self-check of what is going on. And then ultimately scheduling those appointments to see your family doctor, to see your eye doctor, to see your dentist, to kind of, again, put in those self-care days, because this ultimately can echo for years and years down the road, add years to the extent of your life, but also add quality to those years that you want to be living and enjoying and living your best life. Because if you're taking care of your body, you're also taking care of your eyes, and vice versa. From here, I do want to kind of talk about how to schedule an eye exam. If you're listening to this and if you haven't had an eye exam in the last year, it is recommended to have an annual eye examination. Most health insurances, if you live in the United States, most health insurances do cover an annual eye examination, or at least every 1 or maybe 2 years. So something to check with if you have insurance. Check with your provider. Otherwise, there are, of course, other ways to certainly get an exam. You can just call an eye clinic and ask kind of what their prices are at to see the doctor, to have things checked out. Some clinics do offer their own kind of special payment plans and things that you could be looking into, or to see if there's maybe a vision benefit plan or something offered from your employer. And if you happen to be a parent and kind of wondering, hey, when should I be bringing my kids in for an eye exam? Because I'll tell you the truth, most kids will not just volunteer that they're seeing blurry. They don't know, they have nothing else to compare it to. So it is found and recommended that kids be evaluated by an eye care professional sometime within the first 6 and 12 months of life, even just so that we can make sure things have developed correctly. After that, around the age of 3, and again, assuming everything's going well, around the age of 5 or 6 before going into kindergarten. Those are the major time frames for children to be evaluated for their eyes. Now, from here, I just want to take a second to kind of share a deeper personal motivation of why I think eye health and vision and eyesight is so important. Certainly as an eye doctor, I care about the eyes and vision. But even for me as a young kid, I recognized the importance of the gift of eyesight. I recognized the beauty of the world around us, and how having good eyesight is truly a gift of being able to visualize what's in front of you, help you navigate your surroundings, right? It helps us with our safety, but it also helps us with our performance, like again, our ability to perform, whether it be at sports or in school or in our job, but being able to do things efficiently, quickly, and in really just beautiful ways. But then there also is this quality of life component, because so many activities that I know I love and enjoy would be very difficult to do if I could not see what was in front of me. And so it does scare me that maybe someday in my life, because I know I have a high amount of myopia or nearsightedness, I do carry a higher risk of certain eye diseases. And so it scares me to think that there may be a day where I will lose the quality of my vision and there will be nothing I can do. And so that kind of falls back on why it's so important to be proactive, why it's so important for me as an eye care professional to get this information out there, because I want as many people to have as good a quality of vision for as long as they possibly can, so that you can keep enjoying and doing the things that you love to do, that makes life worth living. Hopefully with all of this, it opened your eyes, and yes, pun intended. And I hope that if you found value in today's video, this whole episode, to not only like it and follow, subscribe, but to share it and share this episode with somebody that you definitely needs to get scheduled for an eye exam. Now, with all of that being said, if you not only found this episode to be educational but empowering, and you want to connect with us on a deeper level, you want to learn more about what's going on with the eyes, other resources of how you can take care of the eyes, vision, and your overall health, then subscribe to our Dr. Eye Health newsletter. This is a weekly newsletter that keeps you updated on not only what we're posting, whether it be here on the podcast, but on YouTube and across social channels, but also keeps you updated on new and upcoming news that's happening in the field of eye care. This is new medications, new treatments, kind of just new changes that are happening in this space, but also access to discounts that help save money on things like eye drops or warm compresses or other kind of cool things that are coming out in eye care. Again, you can sign up for our newsletter at dreyehealth.com. And let me just finalize today's episode by saying thank you so much for being here. Keep an eye on it. And remember that the eyes are not just a window to the soul, but a window to your health. We'll see you in the next episode.
You've been listening to the Dr. Eye Health Podcast with Dr. Joseph Allen. For more resources, trusted information, and helpful tools, visit dreyehealth.com. Thanks for joining the community that's focused on healthier eyes and a healthier life. Until next time, stay informed and keep your vision sharp.